If you do this, you become a member of a tremendous force that is working to advance the nursing profession.
To be educated, but I'm so frustrated. Hello to
Hi
my
there,
lonely-
this is Bernice Odudu of Caring Hearts. At Caring Hearts, nurses learn how to successfully navigate the complexities of the healthcare system and break the barriers which limit them from succeeding. Valuable practical tips not taught in the classrooms are shared weekly. These practical tips will help you build confidence, overcome cultural shock, and advance your career. Why not check out our previous episodes? You will certainly find some practical tips just for you. Are you still stuck in the ways you used to do things? Are you still using the same archaic method to complete everyday tasks? As nurses, it is easy for us to get into a rut, carrying out the same tasks over and over again. Most likely because that is the method that we have been instructed in or are familiar with. The fact that you have been completing certain tasks in a particular manner for a long period of time doesn't mean that the approach is the safest or that it incurs the fewest costs overall. The delivery of healthcare is continuously being transformed by evidence-based practices, which are designed to assist nurses in working more efficiently, delivering high-quality care, and ensuring the safety of both patients and the healthcare workers. The following are some old practices that some nurses are still accustomed to carrying out. Putting on gloves without first practicing good hand hygiene. It is not necessarily the safest way to carry out a process simply because it requires the use of gloves. According to study, the most safe course of action is to couple this strategy with proper hand hygiene procedures. 2. Massaging an area where an injection site has been given. According to findings, it is something that ought to be avoided, particularly when the zip track method of injection was utilized. This is done to prevent the pattern of absorption that is desired. The use of auscultation technique. This technique ensures the nasogastric tube is in the appropriate position. Research has shown that X-rays are the most effective methods for doing so. Sharing these old habits is something I could do for hours. Not only are some of these procedures unsafe, but they also increase the volume of work that needs to be completed. Keeping abreast of the most recent development in nursing is crucial for the sake of patient care, professional development, and elimination of harmful at model methods. Here are 10 tips for nurses to help avoid becoming man in outdated method. 1. Make a commitment to lifelong learning and professional development. Participate in nursing-related events such as workshops, conferences, and online classes to keep abreast of the most recent advancement in the field. If you do so, you will be better able to stay up with the latest development in the nursing field. 2. Become a member of a professional organization. Joining a professional organization such as Nursing Association or an organization that does research, grant access to resources, and offers opportunity to network. These groups frequently provide updates on the most effective approaches. 3. Read nursing journal. In order to stay current with the most recent evidence-based practices in the healthcare industry, it is important to read nursing journals on a regular basis, as well as subscribe to nursing journals. Journal articles are a great way to stay up to date on the latest findings gleaned from evidence-based practices. 4. Take part in continuing education. If you want to keep your nursing skills and knowledge up to date and improve them, you should participate in continuing education programs and courses. Sessions of continuing education provide an opportunity to learn new information relevant to one's profession. 5. Look for a mentor. The 5th step is to look for a mentor who has experience in modern nursing methods. They may provide direction, make their expertise available to you, and assist you to stay current in the field when you have the ambition to progress your career. It is a waste of years to attempt to navigate the healthcare system on your own because it is often tough and frustrating. 6. Participate in in-service training offered by the hospital or facility. Make use of the in-service training and workshops that are offered by the healthcare facility where you work. The competency of skills and procedure are frequently the focus of these workshops. 7. Embrace technology. To deliver effective and risk-free patient care, you should become familiar with the most recent advancement in medical technology, electronic health records, and all the types of medical equipment. As awareness of artificial intelligence spreads across the globe, it is imperative that nursing professions find ways to remain current on best practices globally. If you do this, you will become a member of a tremendous force that is working to advance the nursing profession. 8. Coordinate your efforts with your peers. Participate in conversation and exchange of information with fellow nursing professionals. Interactions between peers can offer extremely useful new perspectives on how modern practices are carried out. Take part in activities of your unit's practice council so that you may contribute to the safe and cost-effective transformation of your unit. 9. Remain informed about changes in the regulations. It is important to perform routine checks for updates in nursing legislation and guidelines because these changes may have an effect on how you practice. For the sake of both patient safety and professional advancement, compliance is necessary. 10. Self-evaluation and reflection. One of the most essential things you can do to develop yourself is to think about your own practice and determine the areas which you could benefit from learning something new to bring your knowledge and skills to date. Performing an honest evaluation of yourself can assist you in maintaining control over your professional development, enhance your self-confidence, and overcome obstacles that may prevent you from growing personally. If you keep these guidelines in mind and remain committed to being up to date in the nursing sector, you will be able to avoid becoming mad in out-of-date procedures and give your patient the best possible care. Always keep in mind that you cannot practice what you do not already know. I leave you with this quote. In a global economy where the most valuable skill you can sell is your knowledge, a good education is no longer just a pathway to opportunity. It is a prerequisite. Barack Obama. Thank you for watching. Please share and give us a thumbs up. Subscribe if you are yet to do so. Remember, a caring heart makes a difference.
I wish I knew how much I miss.